All right. Hi, everyone. I am Angela with Sunfish. I am so excited to be here with Dr. Valerie Flores. We have a really fun agenda for everyone today. I know IVF is a big topic, and there's so much confusing information, misinformation, different resources. I personally have gone through 4 rounds of egg retrievals, and even being a professional in this field, have been on Reddit late at night, on Instagram, trying to get answers. So, we are really excited to have a leading fertility doctor here today to answer a lot of your questions. I'll start with introductions and then we'll talk a little bit about how today is going to work while we wait for folks to trickle in. So, first, to introduce Dr. Flores, she works with a leading fertility clinic, San Diego Fertility Center, down in San Diego, which is world renowned. Patients come from all over the world. To get care at San Diego Fertility Center. She is from Southern California originally, did her medical degree at Yale, and has been helping patients for many years. So, Dr. Flores, do you want to introduce yourself a little bit further?
I do. Thank you so much for this opportunity. I'm really excited because, yes, you're right. There's a lot of misinformation out there, and it's really important to make sure that patients are informed and supported. I actually decided to become a reproductive endocrinologist because my aunt struggled with endometriosis-related infertility. And so, seeing the role that her provider played really motivated me to do the same for my patients. And a lot of my research actually focuses on endometriosis. So, I'm excited to be here and talk to patients and prospective patients and everyone here.
Fantastic. And a little bit about myself. So, I'm the co founder and CEO of a company called Sunfish. We partner with San Diego Fertility Center and many other leading fertility clinics around the country to help patients navigate the journey financially, logistically, emotionally. And we offer a few products. We offer all-inclusive flat fee bundle with a partial money back guarantee. So that's really helpful for people to plan, and we support and guide people throughout the process. And we also offer financing options and loans. So people can borrow up to $50,000 for their journey unsecured and up to 400,000 with a secured loan. So that's really great if you're going through surrogacy. I started Sunfish. I've been in this field for a really long time, and I know it's a very difficult emotional process. I've been on the patient side too, also helped run one of the largest surrogacy agencies. And so we just felt like there weren't great solutions to work alongside incredible clinics and started Sunfish to help patients move forward. So, with that, we have a bunch of questions that have come in through our social media, through pre-requested questions for this webinar, but you also have the chance to ask live questions. There's a little chat feature down at the bottom of your screen that is anonymous, so only myself and Dr. Flores will see it. If you want to ask us anything as we go, I'll be fielding all of that. And with that, we are going to be just going for 30 minutes, kind of myth busting, talking about common questions, misconceptions that come up during the process. So, with that, Dr. Flores, first question: does IVF always work on the first try?
That's a great question. I think the best way to answer that is to really look at how success rates vary based off of a patient's age. And so it's not necessarily if it works on the first try, but we'll talk to patients about if you're less than 35, the likelihood of having a baby is over 50%. If you're 35 to 38, it's around 40%. Once we start to get in our 40s, it initially looks like it's low at around 12%. But through being able to do hopefully more than one cycle and ultimately having a normal embryo, then that's when the success rates start to go up again.
Great. Next question: in your opinion, from your experience or based on your experience, do you need to do IVF right away if you're struggling to conceive?
Not necessarily. So when we talk to patients, we're really taking a personalized approach to see what their infertility diagnosis is. And so patients that we normally recommend moving forward with IVF a little more immediately are those who are planning surrogacy, patients with diminished egg reserve, patients who are over the age of 38, 39, 40, just because we're looking at how unfortunately egg quality declines. By the time we're in our 40s, around 60% of our eggs can be chromosomally abnormal. And so with IVF, we have the opportunity to check embryos, to chromosomally check them to see if they're normal or not. Also, patients who have any known genetic disorders, we now have the ability to screen embryos for genetic disorders as well. And then patients with endometriosis, especially those who are over the age of 35, 36, IVF really is the best treatment option. But I think the most important thing to take away is when you see your provider, we'll take your full history and develop a personalized approach for you.
Fantastic. I'm glad you brought up the genetic screening. I think a lot of people don't realize that. I actually have a really close friend who has the breast cancer gene.
Yes,
Um, and she was able to create embryos, screen that out for her future daughters. So there's so
that's
many,
awesome.
yeah, there's so many different reasons that people will pursue IVF, not just that they've been trying for a period of time. I know there's conventional wisdom we get, which is like, try for a year if you're under 35, try for 6 months if you're over 35. But um, that seems to be changing, and there's a lot of different pathways that can feel right for people.
Yeah, which actually, I know this is not necessarily a question, but one thing I did want to highlight is there are some situations where we wouldn't say trying for 6 months to a year. So, for example, patients who have a history of irregular periods or who have polycystic ovarian syndrome, those are situations where we recommend actually patients seek a fertility specialist earlier rather than later to start their family building journey.
Great. All right. Next question. Can you improve egg quality with supplements, lifestyle changes, such as diet, stress, exercise, in your opinion?
Yes, the short answer is yes, but I'll give you the long answer too. So, as women, we are born with a set number of eggs. We don't get to create new eggs the way men are somehow able to create new sperm every couple of months. So, we are born with a set number, and then unfortunately, that number does decline over the years. And on top of that, the quality declines. And quality is really referring to the ability of the egg to divide properly, to have the right set of chromosomes. So, that does decline. But that being said, there are a great list of supplements that we recommend for patients to hopefully help improve that egg quality. So things like CoQ10, NAD, melatonin, and then also for some of our patients who have diminished egg reserve or those over the age of 38, 39, we also recommend DHEA for patients as well. So there are ways to improve egg quality. And then for any patient who's seeking fertility treatment, we do recommend a Mediterranean diet. There have been really great studies showing that that is really beneficial for patients on their fertility journey. Limiting coffee intake to no more than 200 milligrams. And that's really just to help minimize any risk of miscarriage once we're planning pregnancy. And then no alcohol at all, just because, again, if patients may be getting pregnant sooner rather than later, there's really no limit, quote unquote, of what's a safe amount of alcohol. So that's why for alcohol, we definitely recommend eliminating that completely.
Okay, great. I also see a lot of information about whether or not to cut out caffeine. What is your recommendation for someone going through IVF?
So no more than 200 milligrams. It's not that patients have to cut it out completely. I myself have my coffee here that you can't see at the moment. So I don't want to make someone
I
feel
got
that
mine
they're,
too.
I don't want people to go through withdrawals. But in terms of the reasoning, it's actually because, so it's not so much an egg effect itself. It's more when patients are pregnant or actively trying to become pregnant. Anything over 200 milligrams has been associated with the risk of miscarriage. So that's why we limit it to 200 milligrams. And it is important to be mindful of where you get your coffee. So, for example, espresso has around 60 milligrams, but depending on how strong the coffee is at a given coffee shop, a single cup may have more than 200 milligrams. So, just looking that up when you go to your coffee shops as well.
That is a great tip. So we talked a little bit about egg. We actually got a question coming in about sperm on the male factor side. Is IVF still possible with motile sperm count at 6 milliliters per cc?
Yes. So you bring up another important point, which is we cannot discount how much the males contribute for those who are in a heterosexual relationship, how much males slash the sperm can contribute. For a long time, we used to think that infertility was purely a female related disorder. We have learned that actually up to 30% of cases of infertility may be male factor infertility. So it is important for the men to be evaluated. The big test for them is a semen analysis. The benefit of IVF is that we do have the ability to perform something called intracytoplasmic sperm injection. It's a long word, but really what it means is that we can literally, even if it's a small sperm sample, our embryologist under the microscope can select out the best looking sperm and they inseminate them directly into the egg. So you really only need one sperm per egg. So even if the counts are low, it's still possible to have success with IVF. I will say though, the semen analysis in some ways is like a vital sign or a health checkup. So if it's particularly low, we usually will also work with our reproductive urologist colleagues as well to make sure that we're evaluating that completely as well.
Great. Well, thank you. I really appreciate the audience questions coming in. Okay, next question. Once you go through IVF, you create embryos, and those can either be frozen or transferred right away, which is considered a fresh transfer. So, question from the audience: are fresh embryos better than frozen ones?
I love these audience questions. These are things that I was hoping we were going to talk about, and they're already asking the questions, which is amazing. So, for a long time, we used to do what we call a fresh embryo transfer, meaning that patients would go through an IVF stimulation cycle, we'd retrieve the eggs, and essentially a week later, we'd have the embryos and we'd do an embryo transfer. We, for a couple of reasons, have shifted away from that. One is during the stimulation process, patients do have, or female patients who are undergoing IVF do have a high level of estrogen. And we've learned over the years that it's a little too high for the uterus and an embryo that's getting ready to be implanted into the uterus. And so, because of that, we've shifted away from the fresh embryo transfers and now really focus on frozen embryo transfers, where essentially we allow the hormones to go back to their normal level. And in a subsequent cycle, we would place that embryo. And we can do that either through what we call a natural embryo transfer cycle, where in patients who have regular cycles, we essentially kind of watch them ovulate and a week later do the embryo transfer. Or we can do a medicated cycle where we give patients more physiologic levels of estrogen and ultimately progesterone and plan an embryo transfer. And then usually the follow-up question I get to that is there any harm to having these embryos frozen? And thankfully, no. There have been a lot of really good studies to show that the fact that the embryo has been frozen in no way compromises or negatively affects its likelihood of success of an embryo transfer. If anything, because again, we're getting the hormone levels to go back to a more normal state, it's probably associated with a higher likelihood of pregnancy actually after a frozen embryo transfer.
Fantastic. And yeah, I know there's a number of publicly available data sets where patients can actually look up the percentage of fresh versus frozen transfers by clinic nationally, and you can definitely see that trend over time towards the frozen embryo transfers becoming a lot more common medically. Okay, a couple more questions. We'll stick to the theme of medical myths. If I'm healthy, do I need to worry about fertility if I'm young?
That's a great question. And it does get at a very big myth, which is that even if we're completely healthy, we have no medical problems, that doesn't mean that infertility doesn't impact those individuals. Infertility is much more common than we realize. 2 years ago, we were saying it affects 1 in 8 individuals. Now we say it actually affects 1 in 6 individuals. So it is much more common. And a common misconception is that if you're young and healthy, you wouldn't be affected by infertility. But infertility does not discriminate, it can affect anyone. And so I would say that, again, there are certain situations where we recommend seeing a fertility specialist sooner rather than later. But if we go by the general guidelines, if you're over the age of 35 and you've been trying for 6 months, definitely seek seeing a fertility specialist for a workup. If it's been a year of trying and you're less than 35, also seeing a fertility specialist just because there may be something that we can identify and then ultimately, thankfully, through the fertility treatments that are available, be able to correct. There are also some conditions, again, where some women might be born with a lower number of eggs than the average for a given age. So again, that's why we have these guidelines in place. Again, even if you are healthy, it's still important to have that workup, especially if you've been trying for over 6 months to a year.
Great. And we're getting a few more questions about specific conditions that may result in IVF being a good option for people. So, one that folks are asking about is endometriosis. There's one person who wants to know, can endometrial surgery help at any point in the IVF process? And just in general, is IVF the only option for patients with endometriosis?
Excellent question. So that's an area that's very near and dear to my heart. So I will say that with endometriosis, the reason why we do recommend having a fertility workup sooner rather than later is because endometriosis can cause infertility. It causes a lot of inflammation at the level of the pelvis, and so it can affect the eggs, it can affect the transport of sperm through the fallopian tubes, and can also affect the ability of the uterus to undergo all the changes it needs to undergo for implantation. So that's why seeing a fertility specialist sooner is preferred. In general, I would say for those who are less than 35, while I do still recommend fertility treatment, it doesn't necessarily have to be in vitro fertilization. We can do a first line approach of trying an oral medication to get a given woman to ovulate or grow and ultimately ovulate two eggs instead of one, and then combining that with an intrauterine insemination where we process the sperm, concentrate it, and place that directly into the uterus. For patients who are over the age of 35, particularly those who are over the age of 37, IVF is preferred because again, we're looking at one, unfortunately, egg number is declining and egg quality is declining. And then with IVF really targets every single aspect that endometriosis can affect. By stimulating the ovaries, we can retrieve the eggs, take them out of that inflammatory environment. We inseminate the eggs with sperm, watch them develop into embryos, and then we bypass any issues of tubal transport because we place the embryo directly into the uterus. On top of that, with the embryo transfer, we give lots of progesterone. In patients with endo, they can become what we call progesterone resistant. From a pain perspective, it means that usually we have to use alternative therapies other than progestin-based therapies to treat the pain. From a fertility perspective, the uterus can become in some ways resistant to progesterone, and so we can give extra progesterone through an embryo transfer to help really increase the likelihood that the uterus can undergo the changes it needs to undergo for implantation and also improve the likelihood of a pregnancy as well. And there's a study that I'm involved in as well where we're looking at actually suppressing the endometriosis for 2 months before doing the embryo transfer. Again, knocking out all of that inflammation
Mhm.
and making the uterus more receptive to embryo implantation.
Fantastic. All right. So we talked a little bit about preparing for the process, deciding to get started. Let's talk about some of the financial realities. Is it true that IVF costs over $25,000?
So, unfortunately, for the most part, yes, but I do want to talk about what that amount of money means. So, that's covering the medications that patients are going to be taking to stimulate the ovaries. It's covering the ultrasound appointments, the blood work appointments, the egg retrieval, which is a minor surgery. Everything's vaginal, but it's a minor surgery that patients have in a surgery center. And it's also looking at the embryology costs of inseminating the eggs and watching them develop into embryos and then ultimately in embryo transfers. So it can be in the range of 25 to 30,000, but that's what's being covered in that cost,
Yep.
which I
And
know
we
is a lot.
really,
And so I'll pass that back to I was going to say, but I'm excited to have you here too because I know you're going to talk to us about some options for financing as well.
yeah, that's really why we started Sunfish to help with that cost. The number can range dramatically based on where in the country you are, which clinic you're working with, but we typically see about 20 to $30,000 all in per cycle. And I think it's helpful to talk about the total amount because a lot of times when you first go to a clinic and you're just seeing the price of the first step of the process, like just the egg retrieval, it's hard to know how much everything's going to come out to. So having that top line cost can be really helpful to then help you financially plan. That's a big part of what Sunfish does. We create all-inclusive flat fee bundles for patients at specific clinics. And then we also help people financially navigate the journey. So if you can pay for that with cash, with a credit card, great. If you need a loan, we'll help connect you with a lender as well. And there are lenders that do fertility specific loans, or we actually help people get just a general personal loan, whatever's going to work best for them. But there's a lot of different ways to get there. And our team is really excited to talk to people about the best path forward for them to be able to afford that full bundle.
That's great.
Fortunately, we do see more and more insurance coverage for IVF. So, if you're trying to navigate, someone messaged a question. If you're trying to navigate IVF and you're not sure if your insurance covers the process, what can you do? So, I'll take that one too. Most clinics have financial coordinators that can work with you to evaluate all of your benefits. A lot of times, people unfortunately will have insurance, but it might not cover IVF, or maybe it just covers part of the cycle or one round. If you only have partial coverage, Sunfish, our company, can help you basically get resources for the rest or to buy one of the all-inclusive bundles so that you can go through the process. Anything you want to add to that, Dr. Flores?
Yeah, I was just going to say, we also have our financial advisors and patients who are planning their appointment. Actually, even before the appointment, will have a benefits check run so they can have a better idea what may or may not be covered under their plan.
Fantastic. Yeah. So that's something that San Diego Fertility Center offers, many clinics will offer, so you can start to plan ahead. And then your Sunfish care team can also help you gather all the resources you need to be able to move forward or to purchase that flat fee bundle. Okay, great. So we talked a little bit about financial. Let's talk a little bit more about the actual outcomes. So, in your opinion, what is the biggest predictor of IVF success? Is it age? Hormone levels like AMH, number of eggs or embryos? What would you recommend?
Age still is the biggest predictor of success. And it again, for better or for worse, goes back to the fact that as women, we're born with a set number of eggs. But that being said, I will say that AMH does play a big role for us. So AMH stands for anti-Mullerian hormone. It's the hormone that's made by the eggs in the ovaries, and it's a good indirect indicator of how many eggs a given person has. Usually a value over 1 is considered normal. Also, during patient's initial consultation, we also do a pelvic ultrasound where we're checking something called an AFC, which is an antral follicle count, to look at how many follicles or eggs a given patient has in a given cycle. It's important to emphasize that that's not how many eggs a person has left. That's the cohort that they have for the month, and it should be similar for month to month. So age is the biggest predictor, but if you have a really good egg reserve, so if you have a good AMH, if you had a good antral follicle count, that does still help you in terms of IVF success rates, even if you're over the age of 35 or 40, because again, we do want to maximize as many eggs that we can get as possible, because if we know, for example, at 40 that 60% can be abnormal, if we can get a great number of eggs, that 60% kind of dilutes out. And then hopefully, because we can also check the embryos for their chromosomal status, that'll hopefully help increase the likelihood that we have embryos that are chromosomally normal as well.
Really helpful. So, continuing on the thread of outcomes, there is a question that often comes up, fact or fiction, does freezing your eggs guarantee a baby later?
Unfortunately, it does not. So it is a great option for patients, and it is in some ways an insurance policy, but it's not a 100% guarantee. And the reason why is because a lot of individuals are freezing their eggs. Not necessarily everyone is using their eggs. And so the sample size that we have to work with to say this is X number of eggs that you need to 100% equal a likelihood of a baby, that sample size is a little bit small. But that being said, we do have algorithms that I talk to patients about to say, based off of your age and based off of your egg number, how many do I think we would need to hopefully have a good likelihood of having at least one baby? And so for individuals who are less than 35, we usually say around 20 eggs should hopefully equal one baby. Usually the next question is why so many? And so that brings me to another component of actually IVF as well. So even though we may retrieve 20 eggs, not every single egg is going to fertilize, and not every single egg is, or not every single fertilized egg will become an embryo. We usually say 70% of the eggs that we retrieve and that are mature will ultimately fertilize, and only 50% of those will ultimately go on to become an embryo. So that's why we like to start off with that higher number to hopefully have a higher chance. And so again, it's not something that I don't recommend. I actually highly recommend freezing eggs, because your eggs will always be as good as the age that you are now, and they are frozen in time forever. So there have been studies looking at even eggs not being used until 9 years later, the viability should actually still be the same, meaning there shouldn't be any degradation of the eggs. And the other question I usually get is, are we harming fertility by retrieving these eggs, whether it's for IVF or for egg freezing? And the good news is we are not. Each month, even though we ultimately ovulate only one egg, the ovary actually recruits several eggs to grow in a month. One gets ovulated, the rest unfortunately die off that month. So if anything, we're rescuing some of those eggs. So we're not in any way harming your future fertility either.
That was fantastic. You hit on every frequently asked question about egg
Oh, good.
freezing.
I'm
And
glad.
yeah, I think it's so important that people realize this is not a guarantee. It's definitely a helpful protection if you can afford it and have the time to go through it. It's a really helpful option to do. The sooner the better, but it's not a guarantee. And I think what's so hard with this, our team's obsessed with data and numbers, but each individual person is not a statistic. So if you have a 50% chance of having a baby, you're not going to have 50% of a baby. It's either it works or it doesn't for you. So for you, it's either 100% or 0%. And it's helpful to see the data, but at the end of the day, each person is going to either be successful or not. So it's really hard to translate those numbers into what that's going to specifically mean for you and your family. Um, Another question that actually comes up a lot is if you are thinking about doing more than one round, so whether that's egg freezing or IVF, if you're trying to plan for that, what advice would you give for people? And both on preparing for the journey, and I'm happy to speak financially on preparing for more than one round too.
You. So I think a big piece of advice, and this is not my term, so I can't take credit for it, but it's a term that we use frequently. It's a marathon. It's not a race. It does take time, just because, again, there's usually a preparation month before we actually start the stimulation process. Then we go through the stimulation process. If we're freezing eggs, that is a little bit shorter, because the day that we retrieve the eggs, we also freeze the eggs. But if we're creating embryos, even after we've retrieved the eggs, it does take a week to ultimately get to the embryo stage. And then if we're going to be biopsying the embryos to check for chromosomal issues or genetic issues, that takes another 3 weeks to come back. So it truly is a marathon. And then there are some situations where we may need to do more than one round. From an egg freezing perspective, if we want to get that number 20, if we don't get that in that first round, we may want to think about doing a second round. For patients who maybe have diminished egg number, from the get-go, we'll talk about potentially needing 2, maybe even 3 cycles. And we can do them back to back. There isn't any harm in that. And the other point that I wanted to also get across is that IVF itself is not harmful. In order to have any slight risk of cancer, like breast cancer, ovarian cancer, patients would have to do over 10 rounds of either egg freezing or IVF to really have even the slightest risk of any of those cancers. So it is thankfully very safe, but can take a toll. And so there's no problem in spacing it out. We can technically do back-to-back cycles, but it's also absolutely okay to take a mental break, a physical break, also utilizing other resources like acupuncture, journaling, having a therapist, just because it's a lot. It truly is a marathon and not a race, and it does have a huge impact on women and couples. And the most important thing is that we are here for you. And so we will go at the pace that you want to go at, because we really want to make this as smooth of a process as possible for you.
That is such great advice. And financially as well, we say the same thing. This really is a marathon. If you need to break the journey into stages, that can be very helpful too. Specifically, if you are planning on IVF, it often takes people more than one cycle. And so, one of the things we do at Sunfish is we help people prepare for IVF is we offer these all-inclusive flat fee bundles that can be totally customized. So if you want to add a double retrieval or even 3 retrievals into your package or add more retrievals as you go based on the outcomes and how many embryos you're getting, that can all be customized. We can help you get financing if you need for those bundles. And all of our bundles come with a money back guarantee. So if you're not successful, you do get some partial money back in case you need to try again. So all of that holistically can help you put together a really smart financial plan for something that is a really big purchase on top of being financially difficult. It's also physically, emotionally. So it's great if you have a full team to help you. And we at Sunfish are always really excited to work alongside great clinics.
Same.
Um, so, last question that came in, you talked a little bit about the timeline, and someone was asking about the number of days between embryo testing, embryo and embryo transfer. Maybe you can just talk at a high level, a typical timeline for a full IVF
Yes,
cycle.
absolutely. So I would say from start to finish saying that we have embryos to do an embryo transfer, it's about 3 months. It's not that the stimulation takes that long. I do want to emphasize that that does not take that long. It's a really truly more of a preparation phase that happens. So in the first month, before we actually stimulate the ovaries, we normally do what we call a preparation month, where we put women on either birth control pills or estrogen pills. That's helping to really kind of prevent any eggs from starting to grow before we can stimulate them with the injectable hormone. So that's a 2-week process. Then we go into the stimulation phase, which is another 2 weeks. Most women need around 10 to 12 days of injections, and those are FSH and LH, so same hormones that a given woman makes on their own, just synthetic versions, so we can give higher doses to get more than 2, 3 eggs to grow in a given cycle. During that time, patients are coming in for ultrasounds and blood work to see how they're responding to the medication, how the eggs are growing. And then ultimately, we plan for the egg retrieval. And so that's when we have a number of follicles which house the egg that reach a certain size that we say there should be a mature egg in them. Patients get 2 more injections that are triggering the final maturation of the egg and allowing the egg to help separate from the follicular wall so that I can retrieve it for them. Then we do the egg retrieval, an outpatient 30-minute surgery. Patients do get anesthesia, no incisions on their belly. I get a lot of patients asking if it's an abdominal surgery. Everything's vaginal, thankfully. And then after we retrieve the eggs, we inseminate the eggs that same day with sperm. And it takes a week for the fertilized eggs to ultimately become an embryo. We can automatically freeze them, and which is what we do for most patients. Then the next step, though, is we also can biopsy them. So if patients have a genetic disorder or want to do chromosomal testing, it will happen once they reach the embryo stage. Again, though, regardless, we're freezing the embryos because for the genetic test results, it does take about 3 weeks for those results to come back. But during that time, if we know that we're most likely only going to do one cycle, we then start a uterine cavity evaluation to make sure there's nothing in the uterus that would make it hard for an embryo to implant. And then we start the embryo transfer process, which is basically about 2.5 weeks of hormones, ending in the embryo transfer. 10 days later is a pregnancy test. Hopefully it's positive. And about 2 weeks later is that first obstetrical ultrasound. So around 3 months total from start to finish.
Great overview. Right. And then if you're adding in, maybe it takes you a couple transfers to get pregnant, or maybe a couple retrievals, it can take a little bit longer, but that would kind of be start to finish, assuming first retrieval, first transfer, all goes well. Okay, great. And we know that for many people, it will take a few tries. So that's why it's important that you have a great team alongside you. So with that, we're out of time. There's actually a few more questions that came in. So I think we'll have to do a repeat some other
Oh,
time.
yes, I love that.
But this was so great, Dr. Flores. So where can people find you if they want to get in touch?
Yeah, so they can find me. I'm at San Diego Fertility Center. I'm happy to share my email with you, Angela, if that's helpful. We can put it online. I have no problem with patients contacting me, and I'd love to see
Fantastic.
them.
Yeah, great. We'll send out a follow-up email to everyone who joined with our contact info, but um, really, really wonderful to have you. This was such a fun conversation. We covered so much ground. I know people have a lot more questions, but it's so helpful to get time with an expert like you. For me, we'll also send out our contact info. We're at joinsunfish.com. It's free to get that all-inclusive bundle, that package designed for you to see if you want to get that support as you move forward with IVF. In addition to finding us at work, you can find both of us walking our dogs. I have a dog named Autumn. Dr. Flores has a little dog named Lulu. Cycling, we're both cyclists. And I recently learned Dr. Flores also has a black belt in Taekwondo. Wow, what do you not do?
Thank
Um, yeah, so this was really a lot of fun. Thank you guys for joining. Thank you for the incredible questions coming in. I know this is such a difficult process, and every little bit of expert information really helps guide people. So really thank you for being generous with your time. And hopefully we'll get to work together to support some of the folks who joined today on their journey of building a family.
Yes, I would love that. And again, yes, thank you for everyone for joining. And Angela, thank you so much for hosting. I really appreciate this opportunity.
Sounds good. Have a good afternoon, everyone. Bye.